It's a name you might not be familiar with, RU486, but it is a drug you no doubt have heard about recently. It is also being called the abortion pill. And after 2.5 years of review, Health Canada confirmed earlier this year that they have approved use of RU486 in Canada. What are the health implications associated with this drug? What does this mean for the lack of legislation in our country when it comes to abortion? To answer all these questions, we have Dr. Laura Lewis from Canadian Physicians for Life, a charitable organization that seeks to promote public awareness of the sacredness of every human life. Welcome, Dr. Lewis.
Thank you so much, Magdalene.
Thank
I'm
you.
honored to be here.
Oh, thank you for joining us. So basically tell us, what is RU486?
RU486 really is a two-drug combination, but the abortion pill is really the first drug. It's called mifepristone, and it was first released in France in 1988. It is a potent hormone blocker, so it blocks the hormone progesterone, which is essential for thickening the lining of a mother's womb and nurturing the developing embryo in the early stages of its life. And so when this drug is given, it interferes with that, and it essentially causes the baby to lack nourishment and die. And that is the first part of RU486 abortion. The second part is a drug that is used for other medical reasons as well, but it's a drug called bisoprostol, and that is given so that the woman's uterus contracts and it expels the contents of her uterus or the dead baby.
And why do you think it's coming to Canada now? Why has Health Canada allowed it to come into our country now?
I don't know the answer to that, and I did try to look into that, and it's not clear to me. It has been approved around the world. There's obviously there are people that have been pushing to have this drug brought into the country, but I actually don't know the reason why at this time it has been brought in.
Because it has been on the market for so long. It is quite interesting as to why we would allow it into the country right now. Maybe if you could kind of clarify, I know there's been some sort of confusion with the morning after pill and RU486. What's the difference between these two pills?
The morning after pill is a medication that's given within 72 hours of unprotected intercourse, and its primary action is to prevent or delay ovulation. So in that role, it is not aborting a pregnancy or ending a pregnancy. On the website of Plan B, which would be the trade name of this drug, it does say that it could prevent implantation of a fertilized egg. And in that case, it would actually be terminating a pregnancy. But primarily, people would consider this a contraception, so a prevention of pregnancy through delayed ovulation by the drug. Whereas RU486 is specifically an abortion-causing drug. So it is given within the first 7 weeks of a woman's pregnancy, and it is specifically to kill the developing embryo in a mother's womb. So they are very different medications with very different methods of action.
Will this lessen people actually going to their physician to get an abortion procedure done if they can access the pill?
The RU486, there are very strict safety guidelines around this drug, and it still has to be prescribed by a medical provider. So at this time, it looks like it will be physicians, but possibly those could be relaxed, and it could be nurse practitioners or even midwives. And in order for it to be considered safe for the woman, which it is obviously never safe for the baby, but to maximize the safety for the woman, the pregnancy dating has to be confirmed. So if it's over 7 weeks gestation, it is not considered suitable for use. If the pregnancy is actually in the woman's fallopian tube, if it's an ectopic pregnancy, that can be very dangerous and it is not appropriate for use. There are also other underlying medical conditions that would make it dangerous. When even the World Health Organization, when they talk about prescribing this medication worldwide, it says that every facility needs to have access to 24-hour proper medical care in case there is a complication such as heavy bleeding or infection. there are other complications as well. So it is really not, and that is the concern that that I have, and that I think many physicians have, is that those who believe this will answer the question about how do women in rural areas receive abortion access or have abortion access, they think this drug will be something that you can just take home and have on your own. It'll be private and hidden. And yet, women need to have proper and adequate medical follow up. So, if women are not near a medical community, then it will not be appropriate for this drug to be used. There's also a bit of a misleading assumption that a medical abortion procedure has not been available in Canada, and it is available. There is another uh, combination of drugs that has been used for quite a few years, and it's methotrexate and misoprostol. And so women in Canada have already had access to this other abortion technique as well.
Wow, I wasn't aware of that. I know we only have a few minutes left, and I do want to get to, in 2011, the U.S. Food and Drug Administration reported that there were 2,200 adverse effects, including 14 U.S. deaths, 58 ectopic pregnancies, 256 infections. We go on and on and on when it comes to the RU486 drug. Is this true? And I mean, this sounds like there are a lot of risks attributed to this drug.
Yeah, I mean, there's no reason for us to think that it's not true. And even in 2002, a Canadian study done out of the University of British Columbia, it showed that 1 out of every 25 women needed a surgical intervention after participating in this drug trial. So there are definitely complications that can happen, and women have died because of this pill. There have been unusual bacterial infections that have been hard to diagnose. And again, a woman in Canada back in 2000 or 2001 died during a trial of RU486. So it would be very misleading for women to assume that this is a safe and uncomplicated way to solve their unplanned pregnancy. And really, what we need in Canada is not another way for women to end their unplanned pregnancies. We need better options available for women who do not know what they need to do. And many feel like they're unsupported and they have no access to the practical options other than abortion.
Well said. Thank you again, Dr. Laura Lewis.
You're welcome. Thank you for having me on your show.